It's the leading cause of death among young and old in BC. Drug poisoning has been a public health emergency in the province for 8 years now. Last year, the province started a pilot program to decriminalize the possession of small amounts of illicit drugs, calling it a way to deal with the crisis as a medical issue, not a criminal one. But critics of the pilot have been calling for its end. Our reporter Kier Junos has more. In 2016, the BC government and public health officer declared the toxic drug epidemic a public health emergency. The declaration was a result of a significant rise in toxic drug deaths. In the 8 years that followed, the province has battled a continuous rise in toxic drug-related deaths. With more on these numbers, I'm joined in studio by Nima Rajan.
You're right. The numbers are on the rise. Since the government declared the public health emergency, over 14,000 lives have been lost as a result of toxic drug use. Now, that's a startling figure, but to put this into perspective, Rogers Arena has a capacity of around 19,000 fans. Now, if this arena were to house the lost lives, it would be over 3/4 full. Let's break this down even further now. The most recent report by the BC Coroner Service shows that over the years, there has been a continuous rise in the number of deaths to the toxic drug crisis. Now, if you look here, the first major spike occurs in 2016, with 996 deaths attributed to drug poisoning. This is the year the BC government declared a public health emergency. And as we continue along this graph, the numbers continue to increase. The province sees a slight drop in 2019, but the upward trajectory continues even throughout the pandemic years. At the end of the graph, in the year 2023, the province records the highest death rate since the public health emergency was declared, with over 2,300 deaths. Now, here we are in year 2024. The graph at a glance gives you hope that the numbers are on the decline, but these stats are compiled with data up to the end of February of this year. 377 lives that were lost in just 2 months. Startling numbers, but behind the numbers are names of people loved and remembered by their family. Today, our anchor speaks to one of the families impacted by the toxic drug crisis.
As Nima outlined, the number of toxic drug deaths continue to go up. Toxic drugs are now the leading cause of death among British Columbians ages 10 to 59. According to the BC's Coroner Service, that's more than homicides, suicides, accidents, and natural disease combined. Data from the service shows 7 people on average die every day from drug poisoning, but the numbers only paint part of the story. Behind the figures are loved ones lost and left behind. Joining us in studio is Deb Bailey with Moms Stop the Harm. She's here to tell us more about what the numbers don't reveal. Thanks so much for joining us today, Deb. I want to start with your work with Moms Against Harm. This is a very personal cause for you. How did you get involved, and why is this cause so on your heart?
Well, I joined Moms Stop the Harm shortly after my daughter died in late 2015, and Moms is an advocacy and support group. So we try and change policy, but we're also a great support, and they were very supportive to me. You know, when you lose a child, it's a terrible situation. And when you lose a child to a drug death, sometimes people have difficulty talking to you about that in particular. And so when I lost my daughter, Ola, I really was looking for support. You know, we adopted Ola when she was 3, and she was a real life force. She wanted to do a lot of things, and she ended up playing hockey. She was an awesome goalie. She had a black belt. She rode horses. She was in cadets. She played the bagpipes. All these kinds of things, and we, you know, we had hoped that one of these things would take it so that she would have an easier teenage life, because her background wasn't great and both of her parents had been addicted. However, you know, when she was about 13 or 14 or 15 and around there, she met someone, an older man who was a meth and heroin addict, and things just started to go downhill from there. Ola was a very determined person, and I don't think she could understand why she couldn't just quit. She was a heroin user, and she tried many times. She went to different, kinds of supports to get help. But at the end of the day, she succumbed to an overdose of, it was fentanyl and I think crystal meth together. And, it was December 22nd that this happened, but we didn't know where she was because the person that she was with had stolen all her belongings and left her there. And when she was found, it was the 24th. So that's how my husband and my sister and I came to be at the morgue, visiting my daughter, which was, a terrible experience. It was like I hoped when the coroner said, I'll just open the door in a minute just to remind you that she'll be cold. And I'm like, you hope that it's not your daughter, like in TV? Oh, it's not my daughter. But it was her, there she was in the clothes that she left in. And so, I held her cold little hand, and you really want to warm them back up to life, but that's not going to happen. And it's a real shock to your system, and a great sadness even today. So that's why we work at Mum Stop the Harm, to try and stop these terrible deaths that we feel don't need to be occurring.
I'm so absolutely sorry for your loss of your daughter. And, you've put so much into this in trying to stop the harm. Mm-hmm. And you have a booklet in front of you as well. Tell me about Sudden Silence, Hidden Voices, and how does it shed a light on the call for regulated safe supply?
Sure. I did a project called Sudden Silence, Hidden Voices, and what I wanted to show was that the people that we're losing are not only the people in the downtown east side, but people from all over the Lower Mainland and Vancouver, people just like people that you know. And so there are 16 people in here who tell their story about what has happened in their families. And we made that into a traveling display, and we try and put that display all sorts of places where people can confront it that might not be confronting this problem. We hope to draw them in with the beautiful pictures, and then they can go to a website, or right now it's on display at City Hall. Anybody can go visit it in the media room, and there you'll find these Sudden Silence magazines, and you can take one of those and read the stories, which are all pretty heartbreaking. Yeah. I think that most of the people in this booklet, had there been a workable safe supply program, didn't need to die. They could be alive today. Yeah, they didn't mean to die. It wasn't something they wanted to do. I can't think of one really that couldn't have been helped by that, including my daughter.
And you said 16 people, 16 families.
16 families 16 in here,
families.
Yeah.
And I mean, it's unimaginable, but all too common, as we're seeing just in the booklet that you are holding up. What are we commonly getting wrong, and where is there that misunderstanding?
It's actually a complex problem, but a simple solution in a way. The problem is the drugs that people must purchase on the streets are toxic. And they're full of stuff, but most of all, they're full of fentanyl, which we now manufacture in labs, in illicit labs in BC. And people don't know the quantity or the quality of what they're getting, and so are overdosing most of the time. Even in drugs that you think maybe you're going to buy cocaine, we know that it's been found in there, and people have overdosed unexpectedly. So that is a huge problem. So we need to interrupt the toxic supply. I can't think of anything else that's going to work, because people are going to the streets and buying that. We do have safe supply here, but very few people can access safe supply. I think it was somewhere around 5% of the population of the people who use drugs can access it, which means that 95% of the people are getting their drugs from somewhere else, often from the street or dealers that they phone up. Yeah.
And what do you think of the province's approach to the public health emergency? Mixed.
In British Columbia, I think we are the province, or one of the provinces that has come the furthest. We put in lots of programs that we hoped would work. But it's still like we're nibbling at the edges of this problem, and we're plodding along, trying to get something done. We're, dragging our feet when we need to run. This has been going on for a very long time. And, we can't just keep putting in little things, safe supply and then decriminalization, like bit by bit. We need to have a whole plan to be doing this that looks at what's going on and how can we interrupt that. It's a struggle, it's complex, but I think of the words of a doctor that I once talked to, and he just said, no one needs to die from addiction, and that's really true.
And so on the pilot decriminalization project, what are your thoughts on that?
Well, decriminalization, the reason that was put in was to try and stop the stigma against people who use drugs, so that they would not use in the shadows and would come out and get more help. There's an incredible amount of stigma out there about people who use drugs and even about their families. I've experienced that as well. So that they tend to use in the shadows, or they tend to hide their drug use. You don't know who these people are. So the decriminalization was intended to do that. And also it was intended to maybe put those resources that the police and the ambulance used to have to deploy into other treatment resources. That's what the purpose of it was. It was never going to reduce the number of drug-related deaths. How can it? You can be carrying around 2.5 grams of safe supply or 2.5 grams of poison supply, and you won't be criminalized, but you could still die.
And so what are your thoughts on the calls to end decriminalization?
I don't see the point of it. Why go back to criminalization? Maybe we do need to go back and look and fine-tune decriminalization, but I don't see the point of that. It doesn't increase, contrary to what some people are saying, it doesn't increase the drug deaths or the use of drugs. It simply decriminalizes them, but it's been made into kind of a much bigger problem than it needs to be, but it's only a piece of what needs to be done.
Well, thank you so much for being here with us today, Deb. That is Deb Bailey with Moms Stop the Harm. In 2016, the BC government declared the toxic drug epidemic a public health emergency, the result of a significant rise in drug-related deaths. In the 8 years that followed, the province has seen a continuous rise in these deaths, but among the numbers, one group of people is overrepresented. For more on this, I'm joined in studio by Nima Rajan.
Now, one group of people are disproportionately affected by the poison drug crisis in the province. The First Nations Health Authority, based on data from early 2023, found that First Nations people were dying at nearly 6 times the rate of other residents in BC. First Nations women in particular were hit harder, dying at nearly 12 times the rate of other women in the province. First Nations people are overrepresented in the poison drug death toll in the province as well. Since the public health emergency was declared in 2016, more than 2,000 First Nations people have died from drug poisoning, according to the First Nations Health Authority. Now, it's a staggering number, considering there are only about 200,000 Indigenous people in BC.
How will the potential recriminalization of drug possession affect community members experiencing drug addiction? Lorna Bird with the Western Aboriginal Harm Reduction Society and Vancouver Area Network of Drug Users joins us to unpack this today. Thanks so much for joining us, Lorna. So the numbers are staggering 8 years after the province declared drug poisoning a public health emergency. You've been on the front lines of this. Tell me the impact it's had on you and some of your experiences.
Well, I could tell you a lot of different. Like, I lost 2 daughters myself. They were both 20 years old at the time of their death. One died of AIDS and one died of overdose. Now, if we had the decrim at that time, I believe that my daughter Deanna would be alive, or there'd be a good chance that she would be. I believe that a lot of people that right now, the ones that are just doing cocaine, they're the ones that are more likely to OD and die than the ones that are doing heroin, because when you're doing heroin, you kind of get an immune system. Like you can fight against what they're putting in your drugs. So if you're only doing the cocaine, that's what they're putting the stuff in, and that's what people are dying from. So it's like a lot of these people they're homeless, But then there's a lot of them that have jobs too, right? But it's just if they don't know what's being put in their drugs, well, they're, you know, that's why we need this decrim. We have to have it so that you can have your drugs tested, so you know what you're putting into your body.
I'm so sorry to hear that that's impacted you and your family on such a personal level. Why are we seeing such an overrepresentation of First Nations people?
Well, I think it's, like I say, it's because a lot of them are only into the cocaine. They're not into the heroin. And because, like, see, a lot of people, when they're, I think a lot of the drug dealers, they don't even know what they're doing themselves. So, like, they're weighing their dope on one scale and using the same scale to weigh out another type of drug. And so then it's not being cleaned off. So you're getting parts of one drug into the other, which is killing people.
And the province implemented a 3-year pilot to decriminalize the possession of small amounts of drugs. What do you think of that project so far?
Well, you know, I'm glad that they've got it going, but they should have had a drug user involved in the amount that they had. You know, they said 2.5 grams. They should have had a one that does drugs themselves to be able to put their 2 cents into how much drugs that should be allowed to a person. But I am glad that there is some, you know, at least that, because since it started like that, 77% less people went to jail because of it. So that's a big amount.
And in terms of the drug crisis in general, what response would you like to see?
Well, I'd like to see people getting a home so that people don't have to watch them doing it out in the open, for one thing. But I would like to have people have a place where they can go get their drugs tested before they use, so they know exactly what's going into their bodies.
And there's been a lot of concerns about public safety. Where do you stand on that?
It's got nothing to do with public safety. It's what do you call it? Get a person their home. They're not going to be out in the open using their drugs. They'll be in their own home doing it. And that's what the bottom line is. They just get them their homes. That's what they need.
Well, thank you so much for being here with us today, Lorna. That is Lorna Bird with the Western Aboriginal Harm Reduction Society and Vancouver Area Network of Drug Users.